Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's understand the homologous structures. Homologous structures, and this will be in terms of males and the females. So first, moving on to the females. Under the females, the first category will be the genital ridge. So genital ridge, what develops in the females? Genital ridge develops as a ovary. Then from the primordial germ cells, it will be the ova. So ovary is from the genital ridge. The primordial germ cell is the ova. Then from the labial scrotal swelling. Labial scrotal swelling will be the labia majora. And looking at the urogenital fold, it is nothing but the labia minora. Next, we move on to the genital tubercle. So, talking about the genital tubercle, it is the glans clitoris which arises. Then the genital, another part of genital tubercle, it is going to be the vestibular bulbs. Next, the urogenital sinus. What do we have? Under the urogenital sinus, there is presence of the urethral, the paraurethral glands, as well as the Skene's glands. And so sinus there means the presence of the glands. Also, that involves the lower part of the vagina. And there is a greater vestibular glands, presence of greater vestibular glands, and the Bartholin's glands. So all the glands are from the sinus. Next, moving on to the sex cords. So under the sex cords, it includes the granulosa cells. Granulosa cells. And talking about the gubernaculum. Under gubernaculum, it is a round ligament. Then comes the mesonephric tubules, empty. Mesonephric tubules give rise to the oophoron and the paraoophoron. Next, talking about the mesonephric duct. Mesonephric duct or the Wolffian duct. The mesonephric duct or the Wolffian duct gives rise to the Gartner's duct. Gartner's duct. Gartner's duct is nothing but it is a remnant structure. Lastly, we talk about the paramesonephric duct. The paramesonephric duct or the Mullerian duct. So this gives rise to the uterus. There is also the fallopian tube. There is a cervix, as well as the upper vaginal wall. Upper vaginal wall. Now, let's quickly recap the structures which are embryonical structures which gives rise to the female structures. So, in terms of the genital ridge, we are only discussing the important ones. So, genital ridge gives rise to the ovary. The labioscrotal swelling is the labia majora. The urogenital fold gives rise to the labia minora. Then we spoke about the genital tubercle. Genital tubercle gives rise to the glans clitoris, as well as the vestibular bulbs. The urogenital sinus is mainly involving the glands. Next, the sex cords is the granulosa cells. Talking about the mesonephric or the Wolffian duct. The mesonephric or the MW ducts. So this gives rise to the Gartner's duct. Gartner's duct, that is a remnant structure. Then talking about the paramesonephric or the Mullerian ducts. Mullerian ducts are the paramesonephric. This gives rise to the uterus, the lot of structures like the fallopian tube. Next comes the cervix as well as the upper vaginal wall. Now we move on to the structures of the male. So under the male, we discuss it into the same categories. So in terms of females, the genital ridge was giving to ovary. Here it is the testis. Next, we also spoke about the primordial cells. Primordial germ cells, here it is a spermatozoa. Then talking about the labioscrotal swelling, as the name suggests, it is a scrotum. Then talking about the urogenital folds. In females, it was the labia minora. Here it is a ventral aspect of the penis. Ventral aspect of the penis. And that is nothing but the penile urethra. Penile urethra. Next is moving on to the genital tubercle. So under the genital tubercle, it includes a glans penis. Next, the genital other parts of the genital tubercle. It gives rise to the corpus cavernosum as well as the corpus spongiosum. So this is nothing but the genital tubercle. Now talking about the urogenital sinus. So sinus means it is involving the glands. So there is a prostate gland is also part of this. Next is the BUG, that is the bulbourethral gland, as well as the presence of the corpus gland. Then moving on to the sex cords. The sex cords, it led to the presence of granulosa cells in females. So here, what does the sex cord lead to? So sex cords here, it leads to the seminiferous tubules. The seminiferous tubules. Next is, it also involves the Sertoli cells. Then comes the gubernaculum. Gubernaculum, it leads to the gubernacular testis. Then the mesonephric tubules. Mesonephric tubules is leads to the efferent ducts as well as the paradidymus. Now moving on, we talk about the mesonephric or the Wolffian ducts. Mesonephric or the Wolffian ducts. This gives rise to the epididymis. So under this there is a epididymis, the ductus deferens as well as the ejaculatory duct. So epididymis, the ductus deferens and the ejaculatory duct. Next, talking about the paramesonephric or the Mullerian duct. So here there is a prostatic utricle and the appendix of the testis. Appendix of the testis, there is a remnant structure. Now let's quickly recap some important points. So under the males, so where does the testis develop from? Testis is from the genital ridge, the ventral part of a penis or the penile urethra. Penile urethra, this is from the urogenital fold. Next is the genital tubercle, GT. Genital tubercle is from the glans penis as well as the corpus cavernosum and the corpus spongiosum. Then the urogenital sinus, the prostate glands, as well as the BUG, that is a bulbourethral gland, and the corpus glands. Next is talking about the paramesonephric duct as well as the Mullerian duct. So paramesonephric and the Mullerian duct, it stands for the prostatic utricle as well as the appendix of the testis. That is a remnant structure. So talking about the Mullerian or Wolffian duct. So Mullerian or Wolffian duct, here it is the epididymis, the ductus deferens as well as the ejaculatory duct. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.